What if I told you that common habits you believe are harmless are silently destroying your prostate, leading to years of suffering? Millions of men make these mistakes daily. And it gets worse. Own habit is so common you are likely doing it right now, accelerating damage that can lead to irreversible discomfort and constant worry. For generations, ancestors understood how simple choices protected male vitality, something modern life has ignored. Traditional healers warned against habits creating internal inflammation, but today's world has made this wisdom more critical than ever for avoiding the suffering millions face. Startling research confirms losing just 5 of body weight can reduce nighttime urination by 28. Other studies show prolonged sitting dramatically reduces pelvic blood flow, creating constant, damaging inflammation that most men are completely unaware of. I'm Dr. Sarah, and I want to share vital information about the 10 most dangerous prostate habits. What I'm about to reveal is the key to avoiding years of discomfort. Subscribe now, because this video combines shocking science with the practical wisdom every man over 60 deserves to know immediately. Before we begin, tell me, where are you watching from? Have you experienced any of these frustrating symptoms? If this is your first time here, don't forget to subscribe for more vital health insights that could transform your well-being. Today, I'm going to share 3 crucial insights that could transform how you approach prostate health. First, you'll discover the 10 most dangerous daily habits that create silent inflammation in your body. Habits so common you're likely doing several right now. Second, I'll reveal the surprising science behind why losing just a small amount of weight can dramatically reduce nighttime bathroom trips. And third, you'll get a proven 7-day action plan that works alongside your medical care to help you feel more comfortable and sleep better. Let me share William's story, one that perfectly illustrates what I see regularly in my practice. William is 68, a former postal worker from North Carolina, who's been married to his wife Susan for 40 years. He's a grandfather of 5 and father of 4 grown children who loves spending quiet evenings reading. William came to me, already working well with his urologist. What he wanted was to reduce those frustrating nighttime wake-ups that were leaving him exhausted every morning. I coordinated with his medical team, and together we identified some simple daily habits that were actually working against his comfort. Within 6 weeks, William noticed he was waking up just once during the night instead of 3 times. His urologist was pleased with the progress and how William took an active role in his wellness. Today, William continues both his prescribed medical care and these natural approaches, feeling more rested and confident than he had in years. Here's what happens when your prostate health becomes compromised. Your urinary system works like a plumbing system in your home. As we age, the pipes naturally change. This is completely normal. But certain daily habits create pressure, blockages, and persistent inflammation that forces your entire plumbing system to work overtime. Think of inflammation as a slow-burning fire inside your body. Every day, you unknowingly add fuel to this fire through seemingly harmless choices. The wonderful thing is, when you understand which habits feed this fire, you can start making changes that work with your body's natural healing wisdom. I'd love to hear about your experience with prostate health. Have you noticed patterns in your symptoms? What approaches have worked well alongside your medical care? Share your story in the comments. I read every one, and your experiences help other viewers. Let me walk you through the 10 most dangerous habits I see in my practice, starting with the ones that surprise my patients most. Habit 1. The water mistake. Most men think drinking less water at night will solve their bathroom problems. This creates the opposite effect. When you drink too little water, your urine becomes concentrated like thick syrup. This irritates your bladder and prostate, actually increasing that urgent feeling. Your plumbing system needs adequate water flow to function smoothly. In my practice, when patients gradually increase their water intake throughout the day and then taper it off 2 hours before bed, they often find their nighttime trips actually decrease. Habit 2. Sitting too long. Prolonged sitting puts direct pressure on your prostate. Like stepping on a garden hose, the blood flow to your pelvic area slows down, creating stagnation in your body's plumbing system. Research shows that just 30 minutes of gentle walking daily can improve sleep quality by up to 36 and significantly reduce nighttime urination in older adults. If walking is challenging due to joint pain, even standing and doing gentle leg stretches every hour helps restore healthy circulation to your pipes. Habit 3. Too much caffeine late in the day. Coffee and tea after 2 p.m. act like a stimulant to your bladder muscles, making them contract more forcefully. This creates that sudden, urgent feeling that sends you rushing to the bathroom. Your bladder becomes hypersensitive, responding to even small amounts of urine. I encourage my patients to enjoy their morning coffee, but switch to herbal teas in the afternoon. But here's what surprised me most about prostate inflammation. It's not just about the prostate itself. Your entire pelvic area is interconnected like a network of pipes, and inflammation in one area affects everything else. Habit 4. Processed foods and hidden inflammation. Packaged foods, deli meats, and fast foods contain preservatives and additives that act like gasoline on that slow-burning inflammatory fire in your body. These chemicals force your system to work harder to process and eliminate them, creating additional pressure in your plumbing network. When patients replace just one processed meal daily with fresh, whole foods, they often notice feeling lighter and more comfortable within days. Habit 5. Too much red meat. While some red meat can be part of a healthy diet, consuming large amounts daily, especially processed meats like bacon and sausage, increases inflammatory markers throughout your system. Think of it as adding rust to your pipes. Studies indicate that reducing red meat intake and adding anti-inflammatory foods like ginger can decrease inflammation markers by up to 27 in older adults. If this information has been helpful so far, please hit that subscribe button so you don't miss what I'm about to share next. It's important. Habit 6. Holding your urine. When you delay urination, you create back pressure in your entire plumbing system. This puts direct stress on your prostate and can worsen inflammation over time. Your bladder and prostate work as a team. When one struggles, both suffer. I always tell my patients, when your body signals, respond promptly and completely. Habit 7. Smoking. Smoking reduces oxygen flow to all your organs, including your prostate. It's like having poor water pressure throughout your entire plumbing system. The tissues can't heal and repair themselves properly when they're starved of oxygen. Even if you've smoked for years, your circulation begins improving within weeks of stopping. In a moment, I'll share the mistake most people make when trying to lose weight for prostate health. But first, let me tell you about the connection between belly fat and nighttime bathroom trips. Habit 8. Carrying extra weight. Around your middle excess, belly fat acts like a factory producing inflammatory compounds that circulate throughout your body. Research from the European Association of Urology shows that losing just 57 of your body weight can reduce nighttime urination by up to 28. This isn't about dramatic dieting, it's about gentle, sustainable changes that reduce pressure on your entire pelvic plumbing system. Habit 9. Ignoring stress. Chronic stress keeps your body in a state of high alert, producing cortisol and other stress hormones that fuel inflammation. These hormones also cause the muscles around your prostate and bladder to tighten, creating additional pressure in your pipes. Simple breathing exercises, or a few minutes of calm activity each day, helps your entire system relax and function more smoothly. Habit 10. Skipping regular medical checkups. Your doctor can detect changes in your prostate long before you feel symptoms. Think of these visits as having a professional plumber inspect your system regularly. Early detection and monitoring allow for the most effective treatment options and better long-term outcomes. What questions would you ask your healthcare provider about adding gentle lifestyle changes to your prostate care routine? Comment below your questions, help me create better content, and guide how I explain these topics to my patients. Now, here's the 7-day action plan I developed after years of working with patients and their doctors. This approach works with your body's natural healing ability while supporting any medical treatment you're already receiving. Days 1 and 2. Foundation building. Start carrying a water bottle and sip throughout the day, but stop 2 hours before bedtime. Set a gentle reminder to stand and walk around your home for 5 minutes every hour. If walking is difficult, do ankle circles and leg lifts while seated. This still helps circulation in your pelvic pipes. Days 3 and 4. Reducing inflammation. Replace one processed meal each day with fresh foods. Try a cup of ginger tea in the afternoon instead of coffee. Ginger contains natural compounds that help calm inflammation throughout your system. If you're taking blood-thinning medications, check with your doctor before using ginger regularly. Days 5 through 7. Stress relief and recovery. Practice 5 minutes of slow, deep breathing before bed. This helps lower cortisol levels and allows your pelvic muscles to relax. Many of my patients find this simple practice helps them feel calmer and sleep more deeply. What I'm about to tell you changed how I practice medicine. The most successful patients aren't those who follow complex protocols. They're the ones who make small, consistent changes and work as partners with their healthcare team. I always encourage my patients to discuss new wellness approaches with their medical providers. Most doctors appreciate when you take an active interest in your health and come prepared with research-based questions. You might ask, "Doctor, I'm learning about lifestyle changes that might support my prostate health. Based on my medical history, which changes would be safest and most beneficial for me?" Your doctor knows your complete health picture, including any medications you're taking and conditions you're managing. This partnership approach gives you the best possible outcomes. Here's something most doctors don't tell their patients directly. Your daily choices have tremendous power. Every glass of water you drink mindfully, every 5 minutes you spend walking, every moment you choose calm breathing over stress, contributes to your comfort and confidence. The next insight will tie everything together. Your prostate health isn't determined by a single factor, it's shaped by the accumulation of small daily decisions. When you understand which choices support your body's natural healing processes, you can work alongside your medical care to feel your best. The research I trust confirms that gentle, evidence-based lifestyle changes can make a meaningful difference in how you feel. Healthcare professionals I collaborate with consistently report that patients who take an active role in their wellness while maintaining their prescribed treatments often experience better outcomes and greater satisfaction with their care. Remember, you're not replacing medical care, you're enhancing it. Your urologist provides the clinical expertise and medical treatments you need. These natural approaches work alongside that care to support your body's own healing wisdom. If this evidence-based approach resonates with you, please subscribe for more wellness education that honors your relationship with your healthcare provider. And remember, I'm here to educate, not replace your doctor's care. If this reminds you of someone who might benefit from this information, please share this video with them. Sometimes sharing knowledge is the kindest gift we can give. Your prostate health journey is unique to you, but you don't have to navigate it alone. Between your medical team, evidence-based lifestyle approaches, and your body's natural healing ability, you have powerful tools for feeling comfortable and confident. Next week, I'll be sharing the 5 best foods for natural inflammation control that work safely with common medications. It's information many of my patients ask